Hello, my name is Pieter van den Berg and I'm a PhD student at the Delft University of Technology in the Netherlands. In this video I try to explain one part of my PhD research. My research is concerned with the logistics of emergency medical service providers. The models that will be presented in this video aim to find good base locations for ambulances. The Dutch law states that an ambulance should arrive at the scene within 15 minutes in at least 95% of the cases. As a consequence, ambulance service providers try to cover as many points as possible within this 15 minutes. However, this approach ignores the fact that better service is provided when a patient is reached in, for example, 10 minutes. I will show that incorporating this fact can result in a different set of base locations. I will do this by showing the results of two different models for the region of Amsterdam in the Netherlands. First, I show how 6 base stations should be located in order to cover each point within at most 15 minutes. For this region, it would not be possible to cover each point with only 5 base stations. The map shows the region of Amsterdam. The black dots are the selected locations for the base stations. The green dots are the postal codes in the area that are covered. Red dots indicate points that cannot be reached within the time threshold. But since we have complete coverage, no red points are shown in this map. More dots in an area indicate that more people live in that area, and thus that potentially more incidents occur from these areas. Given the 6 base stations, it's interesting to see how badly the coverage would decrease when one of the base stations has no available ambulance. Here, the worst case is when the base in the city center becomes fully occupied. This would reduce the coverage from 100% to about 80%, as can be seen in the map. As mentioned before, the 15-minute time threshold is only used because it's a performance indicator that is used by the regulator. From a practical point of view, there is no particular reason for this time threshold. To improve medical outcomes, ambulances should arrive as quickly as possible, so a response time of 15 minutes is not perfect. This observation is reflected by the coloring in the next map. We see the same 6 base stations as before, but the postal code is now colored green only when it can be reached within 11 minutes. A point is colored yellow when it can be reached within 13 minutes, and orange indicates a response time between 13 and 15 minutes. A response time of more than 15 minutes still results in a red point. We see that a lot of points are colored yellow or orange, and thus have a response time close to the 15 minutes. We can increase the number of green points by changing the set of base stations. This is shown in the next map. We see that almost the entire city center is colored green, but that as a side effect we have some rural areas that cannot be reached within 15 minutes anymore. Clearly, we have a trade-off here. In the current practice, this trade-off is solved by opening more than 6 bases, so that good coverage can be provided throughout the region. Of course, the presented models are simplifications of the models developed during my PhD, but I hope that this video at least gave an impression of the kind of problems that I tried to tackle during my PhD.